Hi everyone. Today in this video we are going to discuss about Valacyclovir. What is this drug Valacyclovir? This is one of the antiviral agent, and within this name we can identify the suffix acyclovir. So Valacyclovir is the prodrug of acyclovir. And the prefix val indicates that this drug is having the valine amino acid which forms an ester. So Valacyclovir is a prodrug of acyclovir which releases the acyclovir as one of the active metabolite. This drug is indicated for herpes infections, particularly herpes zoster infection which produce the shingles, and even it can be used for herpes labialis which produce cold sores, even genital herpes infections. For all these conditions Valacyclovir can be used. And this drug is also effective against herpes simplex virus infections, both type 1 as well as type 2, varicella zoster virus infection which produces the chicken pox, and Epstein-Barr virus infections. For all these infections, Valacyclovir is used as antiviral agent. Now let us see the chemical nature of this drug. So this is the structure of Valacyclovir, and here we can easily identify the valine structure which forms an ester with ethanol. So it's forming an ethyl ester, and this ethyl ester is attached to a methoxy group, and finally this methoxy group is attached to a purine ring system. Let us give the numbering to this purine. So this is 1, 2, 3, 4, 5, 6, then 7, 8, 9. The numbering in the purine is unique. Now this is the 9H purine which is attached by 9th position. So we can write this as 9H purine 9-yle. Then it is having a amino group at the second position, 2 amino. 6th position oxo group is there, 6 oxo. And saturation is present at first and 6th position, so 1,6 dihydro. That is a complete name of Valacyclovir. Now let us see how this drug acts. Valacyclovir is one of the prodrug which is going to be converted into acyclovir. Now this acyclovir is the active metabolite of this drug which inhibits the herpes infection. This acyclovir can enter into the infected cells where it is going to be phosphorylated by one of the enzyme thymidine kinase. This thymidine kinase enzyme belongs to the virus. So initially it is activated by viral thymidine kinase. Now it is going to be phosphorylated to form a monophosphate. This monophosphate is not the active form. It can act as a chain terminator, but it is not producing the significant inhibition on viral replication. This monophosphate is then converted into triphosphate by host kinases. Now by these enzymes, this acyclovir is converted into triphosphate form. Within this triphosphate form, now acyclovir is active. It can interact with the DNA synthesis. Now the DNA chain can be formed by complementary base pairing. For instance, here thymidine can be paired with the adenine on the other chain. This complementary base pairing is mediated by one of the important enzyme, DNA polymerase. Now acyclovir in the triphosphate form can act on this DNA polymerase enzyme, and it can inhibit the activity of this enzyme such that it can inhibit the DNA synthesis. In this way, acyclovir acts as DNA polymerase inhibitor, thereby reduce the viral replication. What are the precautions? One of the important precautions of Valacyclovir is that this drug can increase the risk of thrombotic thrombocytopenic purpura. In this condition, we can observe increased risk of clotting, even damage to the red blood cells. The platelet count is going to be reduced. All these collectively can produce some thrombotic events. And this risk is more pronounced in the immunocompromised patients such as HIV patients or patients with any recent renal transplantation. In those patients, these thrombotic events are more produced by Valacyclovir. Similarly, this drug can produce some central side effects. It can produce some anxiety, agitation, hallucinations. Even it can produce convulsions in the patients. Similarly, this drug can produce some renal failure. So if patient is already having any renal failure, then the dose of the drug should be reduced. This drug can be excreted by renal tubules. So proper hydration is required to dissolve these crystals formed by Valacyclovir. In the patients with any poor hydration, Valacyclovir forms some crystals which can produce further renal failure. So adequate hydration should be maintained during the use of valacyclovir. What are the side effects? The important side effects of this drug mainly include nausea, headache, dizziness, abdominal pain, nasopharyngitis, fatigue, tachycardia, some central side effects such as agitation, hallucinations, and tremors can be observed with this drug. How it is given? This drug is available as tablets at different strengths such as 500 mg and 1000 mg, and the dose of the drug depends on the type of clinical indication. For herpes zoster infection, this drug is started at 1000 mg 3 times daily for 7 days. For treatment of cold sores, this drug is given as 2000 mg given for every 12 hours for 1 day. In case of genital herpes, this drug may be started at 500 to 1000 mg given as twice daily. So that's about this drug valacyclovir, which is a prodrug of acyclovir, and this drug can inhibit the DNA polymerase activity, thereby inhibits the viral replication, and it can reduce herpes infection. This drug is particularly indicated for herpes zoster infections, cold sores, and genital herpes infections. Even it is effective against varicella zoster infections. So that's about this drug valacyclovir. That's for today. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.